Okay, we're ready to do some myofascial cupping on the back. Now, for this particular patient who was in a couple of car accidents, she has a combination of neck and back pain and multiple postural dysfunctions as well. So when you're examining the back, of course, check first the posture. Look to see where the alignment is off so it gives you a clue as to where to zone in on the patient. We're going to start with some larger cups, and we have a selection of cups. This is the giant stepped cup. It works very nicely by just pushing on the bowl at the top, pushes the air out of the cup, and you have a nice grip for your fingers so that you can just place it on the body, and it gives you a fabulous grip. Lifting. Push on the bowl to release. So easy to use. These are great for stationary cups, and they come in a variety of sizes. Extra large, large, medium, here's a few for you, and small. So if you're working on a small area like the sole of the foot, the palm of the hand, a small acupuncture point, you might want to go for the smaller ones. Bear in mind, the larger the cup, the greater the pressure. And this has been shown in research studies, so we're aware of that. It was measured actually in hectopascals. So we're going to start with the big cup covering the larger area. Now we notice if someone stands with exaggerated lumbar lordosis, so they have an inward curve here which is excessive, you could come in with your hands and feel for the glide in the lumbar region. So she has nice skin glide superiorly, inferiorly on the left side, superficially. Right side, inferior glide is pretty good, superior glide is a bit deficient. Of course you could use a tape measure to get exactly the amount of glide. That also correlates possibly with limited flexion forward or limited side bending left, if it's tight in the erectors and the skin, the lumbodorsal fascia on the right side. So I wonder where it is. We come from iliac crest, not too tight here, a little tighter here, definitely tighter here. So just above that iliac crest, that L5-S1 junction, nice inferior glide again, superior glide rather limited, midline also over the sacrum, superior and inferior glide, less superior glide, more inferior glide. If I move up, check over each individual vertebrae. L5, L4, very stiff. L3, very stiff. And I'm just focusing on these fingertips here. L1, not bad, going into the thoracics, more freedom here. Now naturally we have an inward curve in the low back, but there should be some glide. And here, almost no glide over L4, L3. Inferiorly, she has glide. Superiorly, very much diminished. So these segments here, I could tell they're rather tight. If you tested using a skin rolling technique, where you pinch the skin between your fingers and try to lift, very hard to lift. I can't even get that. It's so adherent between the skin and the subcutaneous tissue. A little easier to lift as you go over the sacrum. What's it like on the left? Okay, we're getting very sticky here, where the skin just balls up underneath your fingers. And the same thing here. Once you get right into that area of her lordotic curve, very hard to get a grip on the skin rolling. If I'm going in the opposite direction, okay, I'm tight right at L5, L4, L3, loosening up at L2 and up through the thoracic. So the skin gliding gives you a nice assessment of where the limitation is. So for this patient, it's a limitation of superior glide, particularly L3 to L5. Now my cups rolled away. The cups do have a tendency to roll, so keep a good grip on them. If you want to get a grip on this area and you can't lift effectively with the skin roll, choose a cup. I know some people even use plungers. Yes, those very types of toilet plungers that you've seen in the bathroom. Now, I don't recommend to use ones that have been used before to handle bathroom emergencies. But if you get a brand new toilet plunger from the hardware store, you may find that that comes in very handy, especially because it has a handle. These were specifically made for body work, and also the silicone is something that you can disinfect with a high level of 7.5% solution of hydrogen peroxide soaked for about 30 minutes. Check your Center of Disease Control recommendations, and we have those on our website or in the course manual for our cupping therapy course. So I'm going to push the air out of the cup, get a grip, push the air out, place it right over that tight area, And let me know how you feel with this.
Good.
You're going to feel a little stretching. Now I'm going to check my glide. Right glide, left glide, superior glide, inferior glide. So the inferior glide is nice and bouncy at the end of the range, and that tells me that's pretty good mobility. Superior glide, an abrupt stop to motion. There's my restriction. So I want to hold, and you'll feel some stretch now as I give a little pull of the skin up your back.
Mm-hmm.
Are you uncomfortable in any way?
No.
So she's okay with it. Some patients, the skin is so tight here that it almost feels like an Indian rope burn to them. So just bear in mind that that can be a bit much. So hold, when I feel that soften and release, it feels like the skin starts lengthening, usually after about a minute and a half, so 2 minutes, then I can release the cup. Now because I'm leaving the cup on for a period of time, usually if you leave it on for more than a half a minute or a minute, you're going to start seeing some increase of erythema under the cup. I can easily pick up the cup, take a look, because these cups are colored. I can see through them. She's not getting much of a response there. I'm not using a whole lot of suction. I'm using this more as an extension of my hands, a tool to grip the skin and lift. Typically we're using positive pressure, compression, pushing on the tissue, massaging. This is negative pressure. It's grasping the tissue using the suction, negative pressure, and it's a decompression, so negative pressure as opposed to positive pressure. Just another way to do soft tissue mobilization, and it gives you the added bonus of being able to look through the cup to see what's going on in the skin underneath. So I'm not going to bore you with waiting for all the releases to happen because apparently this one will take a few minutes. I may counter force underneath, but as you see when I pull, the cup releases. Try again and then start going. I could do almost like a cross-hand myofascial stretch, coming up at the cup, down in the sacrum like an inferior glide, if you will, of the sacrum with the other hand. And then holding, waiting for that to release. More commonly, I use the gliding cup technique. So we're going to move into that now. Release the cup. You can see we have some erythema response here. It's very nice. Exactly what we're looking for is an increase of circulation. If I wanted to work both sides, say to get some blood flow to sacroiliac joints, I could use a couple of cups right over the sacroiliac joints and then work on some of my superior glide using the fixation of the additional cups. So we're getting a little bit more work done. I could even hold the cups this way. So opening up that lumbosacral junction, opening up that L3 to L5 restriction that we discovered with our examination. Some people use cupping just static, stationary cupping, leaving them in place for an average of 5 to 10 minutes to increase blood flow to an area, bring up the chi, the energy from the Oriental medicine perspective in that area. But of course, if you leave the cups in place for a period of time, depending on the skin type, you'll start to get a little bit of an erythema response. And with these particular cups, the rim is not a rolled rim, it's a flat rim, so you tend to see the mark of the rim on the skin, and that's fine too. So just to give you some different options for what you want to work with. Now moving into the gliding cupping technique, you want to make sure that you have some lubricant available. I like to use coconut oil, and I have a separate container with the coconut oil. Be sure to use a separate container for each patient. You know, for sanitary reasons, you don't want to have your hands touching the skin and then going into the oil and using that same oil on another person. So individual oil cup for each person. Or some people use a pump. I know for my massage practice I have a pump for oil as well, although coconut oil won't pump, but regular fruit or nut oil will. So as I melted the oil in my hand, coconut oil has a very low melting temperature, so it works quite nicely. You could just lubricate the tissue that you want to do the gliding cups. This way you get some grip from the cups. I'm going to use a little bit more oil, and I like to warm it up in my hand before I put it on the patient. You know, how obnoxious is it that we just dump ice cold oil on people? So that's not as desirable for patient's relaxation. So I'm just going to spread the oil Now typically if I'm doing a regular Swedish massage, I'm going to use both hands, but here I'm just distributing lubricant. We can finish after the cupping with a nice massage, get some good lymphatic drainage. And because we have a larger surface, I have choices. I could use a larger cup, a medium cup, or there's smaller ones, but you can imagine it might take all day of getting around her back with this smaller cup. The other reason I didn't massage with both hands is once the hand is lubricated, it's really difficult to hold on to that cup. So often I'll wear a glove on the hand that's holding the cup that gives me a better purchase on the cup, and it's a lot less strain on the hand. Another tip, if you keep the cups in a towel on top of your hot pack machine or just on top of a warming device, of course only when you're present, you don't want to have any fires going on, I'll warm it up on that first, or warm it up in a bowl of hot water first, so the cup is very pliable and also it's warmer, it feels nicer for the patient. Lube the rim of the cup, and these silicone cups are wonderful because they have the rolled rim that we're looking for. It's flat, it's thick, it feels really nice on the skin, and they actually did some studies comparing rolled rims to flat rims. The ones in these stationary cups are flatter, and they found that the rolled rims distribute the pressure more evenly, which is always nicer for the patient. So coming back to that tight low back, squeeze the air out of the cup, place it. She was tighter on the right, so if I'm focusing on the right today, of course depending on how much time you have to spend with the patient, how many other interventions you have planned for their treatment program today. So I'm just feeling, where is the tension? I feel much more tension as I'm coming superiorly with the cup. I like to get right at those attachments along the iliac crest, staying just lateral to the spine, getting over the erector. So you're seeing, of course, the skin is mobilizing. We're lifting the cup a bit. If you look underneath, if you get a little close up there, looking through the cup, you'll see the elevated bowl of the skin, almost like a ball of skin. I like it to look like a nice little hamburger bun. So that's something, get you hungry while you're working. So have that little hamburger bun going. I'm going to focus on the superior glide. And now and again recognize, yes, the patient is indeed on the table. How are you doing? How does it feel?
Feels good.
Do you like it a little bit slower or faster?
The speed you have is good.
Good, see?
Yeah.
It's a compliant patient. She'll go with the flow. Sometimes I'll do little circles or a sine wave. I go with what I feel under my hands. And what does that mean? I'm feeling the tension is much greater as I'm imparting a superior glide with the cup, and that's telling me that's the restriction that I'm working with. Sometimes it's so restricted I have to grab the cup with my whole hand, and I'll actually twist the cup to make it easier. So especially if you have somebody who has body hair, or if the skin is extremely dry and you didn't do enough lubricant, twisting the cup, a little torsioning effect, helps you get going and gliding more easily than just a straight drag. A straight drag is really nice to get more stretch. So depending upon your particular goal for the therapy, you could do what you like. I like to follow out from the ribs. Take some deep breaths in now. Nice deep breaths. Feel your ribs expand as we work over that area. And this is where, again, I'd recommend, if you're going to be spending several minutes cupping, the silicone cups are slippery. And you're bound to get oil on your hand, and then you have to grip harder to maintain a purchase on the cup. Go ahead and get a nice, Nylatex glove, non-latex glove, so you can go ahead and get a good grip for a longer time. Now, right in the midline, you can certainly work over the midline with the cups. She is most restricted here. So I'm slowing it down quite a bit. You feel that pull? Let me come over there. Slowing it down and just waiting for that softening. Sometimes I'll stop and just hold it with the grip. So you have a nice restriction on a strain. Remember, strain is just another word for stretching. Lengthening the tissue. And it was super sticky, so I had to just turn. You can see, now notice there's a lot more erythema in that area. These are some healed scars. We're not working over any open wounds here. If they have rashes on the back, broken skin, inflammation, any irritation in the skin, of course, we're avoiding using the cups until that clears up. And to release the cup, just squeeze. Another way to release the cup is just slip your finger, let a little air in, very, very gentle. And that's a lovely way to open up the midline and the right side of the back. We would do some testing on her to see, did she increase her lateral flexion goniometrically? Did she increase her forward flexion? You could do a forward bend test. If she had some issues, say with her sacroiliac joint, you might then check your flexion test, your march test to see, did that change? I also do the cupping directly over the sacrum, the glutes, and all of this. You could do that with patients properly draped. And that'll give you some ideas for the low back. Of course, in real patients, we would check both sides, and if they're restricted, work both sides, or at least get a little massage action to balance on the other side, and follow up with some nice functional activities, some therapeutic activities, and a home program. So that's our treatment for the back. Thanks for watching.